Good afternoon. Welcome to Workforce Wednesday. Joining me today, I have Bridie from Aveanna Healthcare, and she will be here discussing her positions available in our area.
Hello, Emily. How are you today?
Good. Do you want to get started by just telling us what Aveanna is, where some of your locations and what you do?
Sure. I'm Bridie Jacques. I am the Business Development Manager for Aveanna Healthcare. We have offices in Elephant, PA, and we also have another office in Wilkes-Barre. Both offices service kids who have multiple disabilities and need nursing and also aid services at home and at school. We also offer services for veterans, of which we just started recently servicing veterans all over Pennsylvania. I work very closely with the VA hospitals. I've been branching out into Connecticut and New Jersey recently, which is a big step for me. But yeah, so we offer a lot of the services right now. We're working on getting nursing needs set up for school right now. School is a big time of the year right now, last minute crunch because schools are starting up very soon. And we have a lot of our kids who need nursing and aid services to get ready to go back to school.
So you're looking for nurses to sit with a kid throughout school, kids that need help throughout their day.
Yes. So a lot of them can't go back to class without a nurse, especially if the schools don't have nurses at school available for the needs that they have. A lot of them are have seizures during the day, diabetic kids, kids with autism who have incontinence, things like that, that need an aide or a nurse with them. And we have a lot of kids that year over year have the same nurses, but because of nurses that are retiring or have taken on another kiddo, some of our kids from last year don't have the same nurse this year. And we were recruiting over the summer and we were unable to fill those positions. So now we're looking to find those nurses now before their classes start, either like the end of this month or the beginning of right after the holiday, right after Labor Day, when classes start again.
What nursing level are you looking for? Like nursing assistants, RNs, LPNs?
Most of them are LPNs.
Okay.
We require our RNs, LPNs. They basically do the same positions. Only some of our kiddos are trach vent. That not many. Most of our kiddos are low tech acuity. And a lot of our kids just need an aide. They need a certified nursing assistant or a CNA. Those are kids with they just need incontinent or bathroom reminders. They need redirection while they're in the classroom, or they have uh, like cerebral palsy. They need assistance
Mhm.
getting around, help with eating, or they are an elopement risk, or they have pica tendencies, things like that. And they just need to be monitored.
Is there a specific number of nurses you're looking for to work with the children?
Right now, I am in a dire need for, let's see, two aides, one aide for Mountain View Elementary, one for Riverside East, which is in Music. Those are school cases for those aides. I have a big need for Wall and Paul Pack Elementary for nurses for those school cases. And I need desperately for John Adams School in Scranton. I also need for Friendship House in Scranton for school cases. Those are seizure students that I need for. And Valley View Elementary in Archbald, I need an LPN for that as well. And Monticello School in Scranton, I need an LPN for that as well. Those are my biggest needs right now for the school cases, those LPNs and aides to get those kiddos back in class.
Yeah, they need to get back to school.
Yes, yes. Every child deserves to be in school.
Exactly. Um, what are the other positions that you are looking to discuss today?
Some of the positions that I'm looking to discuss are, like I had said, we're working very heavily with veterans in
Mhm.
our area. everywhere from Tunkhannock all the way out to Berwick. We're doing locally, we can hire direct care workers. We're also hiring veterans to work with veterans, and direct support professionals can also work with our veterans. All they really need is help with activities of daily living, laundry, grocery shopping, doctor's appointments, assistance with meals, light housekeeping, medication reminders, incontinence. They need help with their hygiene, things like that. There's no real specialized training to do this. You just need a driver's license to help them get around. Sometimes you don't even need that, just Uber. Uber will work. But we can hire relatives, we can hire neighbors, friends of the family that can assist. That it's very simple to get onboarded, just background checks, FBI fingerprint clearances, things like that. It just be aware of their needs. A lot of them are dementia patients. You have to have a gentle touch with them. Our veterans mostly are elderly, and dementia and PTSD. That's really no joke. You have a very gentle touch with them, and they don't like to be touched very much. They will get a little bit combative with you. So you have to be understanding of who they are and what they've been through. So
what is something you would want to tell a viewer that might be interested in moving forward with the application process?
You can call either our Oliphant or Wilkes-Barre branch to work with a veteran if you're interested, or work with any of these kiddos that need help with schooling this year. You can reach out to anyone who answers the phone. Let them know what kind of case you're interested in working with. The veterans cases are smaller hour cases. The school cases are longer hour cases. They would just need to get your basic information. They can send you application via email, and then they can start the onboarding process. A lot of it is computer work, so you don't necessarily have to come into the office until you're ready for orientation. Once you come in for orientation, it's just a few hours. If you need to do CPR training, they can do it right here in the office. It costs you nothing. We don't charge for any training. It's free to you, and it follows you wherever you go. Those of you who already have your nursing licenses, all of that, they would just get the information. You can send that right via email, and they can get your hours of availability, your flexibility. Aveanna is very flexible with scheduling. You just tell them how many hours you want to work, what area you want to work, and they will find the case that fits you. Onboarding can take a little bit of time. You do need a current TB test. All schools require that. Yeah, it take about 2 weeks to get you onboarded.
So fingerprinting, you have orientation, CPR tests, background checks.
Yes.
Okay.
Yeah.
Anything else you want to mention about the positions?
A lot of the nursing positions come with sign-on bonuses. Okay. Just ask the office what the current sign-on bonus is when you call in. They're all different types of, and then some of the offices are doing recurring bonuses. As you refer another nurse, you continue to get sign-on bonus, or continue to get bonuses with referrals with other nurses.
Nice.
Yeah.
Well, where could an interested person apply? Aveannahealthcare.com or?
Correct. And then you just search by location. Wilkes-Barre, Oliphant, or whatever area you're in. Because remember, we always have offices in Allentown, in East Stroudsburg, in Williamsport, in Du Bois State College. I mean, we're all over
You're
Pennsylvania.
Everywhere.
We're everywhere.
Well, thank you so much for talking on Workforce Wednesday today. I appreciate you taking the time.
Thank you.
Thank you. And I hope that someone out there sees that these positions are available in this video, especially working with the students because school starts very, very soon.
Yeah, next 2 weeks, school
Yes.
starts. These kiddos want to go to school. They're excited.
Well, thank you very much and enjoy the rest of your day.
Thanks, Emily.
Yeah, thank you.